Welcome again, and welcome to part two of Introduction to Dermoscopy, aimed for GPs and GP trainees. And my name is Dr. Kwesi Appiah. I'm a GP with extended role in dermatology, working for Stella Healthcare in West Sussex area, and also I'm a GP in Cheshunt, in Hertfordshire. Okay, so if this is a follow-on from the first part that our first part YouTube video, which is the basics, introduction, and overview of dermoscopy and some basic principles there. So the second part two, we're going to concentrate on a standard approach in kind of looking at dermoscopic lesions on how to standard approach them in practice. So what we do is the standard approach in dermoscopic assessment. You're going to, first of all, for any lesion that you have, you need clinical assessment. History is very important in assessing a lesion, and as you don't want to rely on the dermoscopy alone in making your diagnosis. So the most important thing is the first approach in a clinical assessment is you want to distinguish between a lesion which is either melanocytic lesion or a non-melanocytic lesion. And that's really important to help you in that approach. And secondly, after that, if the melanocytic lesion, then the next thing is you want to distinguish whether the lesion is a benign nevus, a dysplastic nevus, or a melanoma. So that's the approach that you want to use. And if it is a non-melanocytic lesion, you want to distinguish whether your dermoscopy is going to help you to distinguish between a benign lesion, a pre-malignant lesion, and a malignant lesion. Okay, so if a pre-malignant lesion, you want to distinguish between actinic keratosis and Bowen's disease. Okay, and obviously if it's also malignant lesion, you want to distinguish between whether the lesion you're looking is a BCC or a non-melanocytic melanoma or non-melanotic melanoma. Okay. So the methods of differentiation will be either the 3-point checklist to evaluate pigmented lesions by dermoscopy. Those of the GPs in West Sussex and East of Hearts area, you'll be concerned with Arden's template, which is on your system 1, and this has this 3-point checklist built in the dermatology aspect of that template. You can also use the 2-step algorithm in this differentiating between the melanocytic lesions in dermoscopy. So these are when the lesions are considered melanocytic. So in a 2-step algorithm, the first step will be to differentiate between a melanocytic lesion and a non-melanocytic lesion. And the second step is to differentiate between a benign melanocytic lesion and a malignant melanoma. Okay, this algorithms helps you to decipher what you're looking at under dermoscopy. There are various tools that you can use in this differentiating between benign melanocytic lesions and malignant melanomas, and this include things like the 7-point rule, ABCD rule, there's the Mendes rule, or various other forms. So let's simply look at the 3-point checklist. This is for non-experts, and really this is what it looks like on Arden's templates in dermatoscopy templates on Arden's. It was helpful for those of you who are involved in this pilot from for London Cancer Network, because you'll be able to record your images or your lesions on this template, which makes it easy for you to search when you go back and do your audit trail for all your dermatoscopies that you have done. Okay, so you can, when you've done the procedure, you tick here for dermatoscopy or dermoscopy that you've done. that will make it searchable. You can record your history here from the patient, and then what you see macroscopically without using dermoscope, you can describe that here, and then also you can describe what you see, the features on dermoscopy, which helps you make your diagnosis here as well. Sorry, I'll go back here. So that's this way you describe what your dermoscopic features in here. So the 3-point checklist has the asymmetry of color and structure. Remember, it's asymmetry of color and structures, which is the structures within the the lesion, but not necessarily of the shape or of the lesion. And also, it has here. Keep on going back. Sorry. I should show you. Also, you can talk about atypical network, and also blue-white structures. You can always put all of them here in the 3-point checklist. So atypical network, asymmetry structures, blue-white structures, and then it gives you the risk score here. So if you get score 1 here, 1 here, 1 here, the total score will be 3. This is quite helpful, and obviously you do the drop down here, you can make your diagnosis over here as well, and your management plan can be recorded here. So this is just to help you in your recording of the lesion as part of this audit trail. So 3-point checklist, a little bit into details of the main aim of the 3-point checklist is to determine whether the lesion being examined should undergo biopsy. So it's not does not require accurate diagnosis, and it is made for really the novice and non-experienced people in dermoscopy, which just kind of give you an idea that you don't need to have the finer features, but really you think this lesion looks suspicious, that you requires biopsy, and either under 2-week wait or referring to dermatology. Okay, and then pigmented lesions are marked from 0 to 3. Mark on the 3 criteria as I've explained, and each score is 1. Okay, a score greater than 1 is highly suspicious, and then you refer because of that. Okay, so result from a study of screening shows that the sensitivity of detecting malignancy by non-expert increased from 69.7% to 96.3% after an hour of tutorial using the dermoscopic criteria of the 3-point checklist, which is really good. So, however, it is not very specific. As I said, it doesn't tell you in the final details of the images on dermoscopy. Therefore, the specificity is much lower than you don't expect. So further studies by even dermatologists, when they did a bit of kind of a tutorial of 15 lesions using this 3-point checklist, they also increased their sensitivity to about of about 71.9%, which was only 4.2% less than the experts when they've done the same tutorial. So it's good to help you to increase your sensitivity. Obviously, not very specific because the details are missing 3-point checklist. So it's good tool to use at this age. So let's go details. So 3-point checklist talks about asymmetry, and as I said to you, asymmetry is of the color and structures in 1 or 2 perpendicular axes. So color and structures. And then the second part is atypical network. So atypical network, whether the pigment network with regular holes or thick lines. So whether the network is typical or atypical. And again, whether the symmetry is symmetrical, or the lesion in terms of color and structure is either symmetrical or asymmetrical. And the third part is, are there blue-white structures in the dermoscopic features, in the dermoscopy image that you're looking at? of the lesion. Any type of blue or white color, that is a combination of blue, white, veil, structureless regression, doesn't distinguish between the blue-white structures you find in melanomas and BCCs, but it still tells you that this lesion requires biopsy. It scores you 1, and obviously you can refer because of that. And if you're suspicious of that, it's going on 2-week wait anyway. So this is asymmetry. When you're looking at asymmetry, this is what you're looking at. You're looking at the structures. This is a symmetrical lesion. So you're making sure that the network is symmetrical. The distribution of the pigment is also symmetrical. So even though the shape of this lesion is not symmetrical in all axis, longitudinal perpendicular axis, is symmetrical with structures, network, and pigment. Okay, so asymmetry of color and structure is not the lesion shape, and that's what the schematic diagram shows you. This will score you 0 because this is a symmetrical lesion. Okay, there's no asymmetry in this lesion. Therefore, the score for asymmetry is 0. Good. So this is another dermoscopic image of a benign nevus. It has an asymmetrical shape. However, there is symmetrical colors and structures. So the pigment network around the peripheries is light brown uniform pigment, shows you symmetrical color, and the dark color in the middle is uniformly symmetrical. So symmetrical both in color and the structures. So this is a pigment network, and the dark globules, this will be the globular structure in the middle, shows you that this is a benign nevus, probably a componevus, but benign melanocytic nevus on dermoscopy. Symmetrical both in color and structure. Concentric pattern, dark brown globular area in the middle, light brown reticular network on the peripheries. Score is 0 for symmetry. So this is symmetrical, therefore there's no asymmetry in this. Score is 0. So schematic drawings, typical network is the second thing. So network, the second part of this 3-point score. Network is the lines differing colors and thickness. So in atypical network, they will have a differing colors and thickness. So the colors will be darker here, lighter brown here, whereas in a typical network, it is uniform brown. The holes are uniform. Therefore, this is a typical network. So if the holes are different in color, in sizes as well, the holes are different in sizes, that's also atypical network. Okay, so atypical pigment network usually have irregular distribution throughout the lesion, like in this one. In typical network, similar colors, thickness, and size of holes. So let's compare a few dermoscopic images here. Atypical network versus a typical network. So this one, just look at network alone, a network alone. You see that this is an atypical network. So there is some distribution of dark colored networks here, around 7 o'clock here, 6 o'clock here, around 5 o'clock there is a darker color network. There is a lighter brown network here. So these are the blackish areas here. However, also when I look at overall score in terms of 3 points, this has some blue-white structures in the middle, blue-white structures in the middle, and that's also a score me of 1 in terms of blue-white, and also symmetry-wise, there is a asymmetry in distribution of the pigment. So there is a pigment here, pigment here, pigment here. Pigment is a bit darker here. So in overall score, from using the 3 points score, I'll say this one will give me a score of 3. Diagnosis, this is a suspected melanoma. You're going to refer to it. With this lesion, which is the benign melanocytic nevus, networks are typical. Okay, the network is typical, so there is a surrounding reticular network around the peripheries, light brown. It's quite uniform. There's a globular dark structures in the middle, quite uniform. So in terms of symmetry, you see that the symmetry is uniform. Network is typical because there is a typical network on the edges and there are no blue-white structures in this. So this will give you a score of 0. 0 for asymmetry, 0 for network, and 0 for blue-white structures. This is a benign nevus. Okay. The third component of the 3 points checklist is the blue-white structures, and the blue-white structures here are demonstrated schematically like this, what you see in terms of drawing and painting. So they include either blue, gray, or white colors within the lesion. These structures are often also seen in melanomas and in BCCs. Sometimes you can see them in benign lesions, like a blue nevus, where you have a homogeneous blue area, nothing else, because they are quite deep in the dermis and mostly in the reticular dermis, or very deep hemangiomas in the reticular dermis will also give you kind of a blue tinge, a homogeneous area as well. So that's, or you can see either even if you have a lacunas in a very deep hemangioma, that will also give you some blue-white structure. So it's not just because this is a triaging tool. The 3-point checklist is a triaging tool. It just helps you to identify some things, but no one criticizes you if you think you're not sure. It's got blue-white structures in deep there and you're not sure, you can refer. But again, it tells you that it's not very specific, but it's quite sensitive enough to think that there is something that requires a biopsy, unless it has other features to reassure you. Blue-white veil or regression are the white structures where you see in the melanoma, and is due to kind of a keratinized kind of fibrosis in the dermis part of the melanoma, as a deep, thick melanoma to show that. So that's what blue-white structures are. So some dermoscopic images here of blue-white structures. This is a BCC, so you have this blue-white structures, or ovoid cyst or ovoid nest as they are called, or you have these blue-gray structures in there, and this is part of a BCC dermoscopic feature. If you're looking at the whole 3-point checklist for this lesion, you'll see that the pigment, the symmetry is a bit symmetrical in terms of the distribution, but is atypical, and there is a blue-white area there. Even in terms of symmetry as well, you might even say that, well, the distribution of the pigments in the blue-white areas is not symmetrical. So I probably think this might be a 3 rather than a 2, to be honest. But it doesn't tell you that it's a melanoma. It just tells you that it needs a biopsy, because it's basically a triaging tool. But if you add all other dermoscopic features, which you will learn later on about BCC, it will tell you specifically what you're looking at, because it's got some arborizing blood vessels over there, that, and then you can also see the leaf-like projections over here as well on the edges, and then blue-white globules. There might be some other micro ulcerations there. This tells you that this is a BCC you're dealing with. So this is blue-white structures that you see in regression structures of a melanoma. So again, when you see any areas of scarring, pinkish scarring area here, this is a melanoma. This has an atypical network because there is dark areas. There's also a bit of much dark areas around the side here, and just not that's not nice. So there's asymmetry, atypical network, white regression areas. This is, your melanoma. These white areas correspond to fibrosis, as I said, and they are things that you need to look out for in a lesion. So this will give you a score of 3. This lesion requires excision. Another part of the 3-point checklist is also a benign, nevus here. So this here you have the benign nevus here. Score is 0. Symmetrical shape, typical network, no blue-white structures. Using a 3-point checklist you record on your Ardens, you score at 0. This again is a asymmetrical lesion in terms of distribution of the globules. However, it has a typical globular network there. Globules, not network, but globules, typical globules, and also no blue-white structures. So the globules structures, the globular structures are typical, as you see in the distribution might be asymmetrical. However, this is a normal nevus because it is, only shows you typical globular lesion structures, but no other features suspicious of a melanoma. So you can see some of the terminologies are quite too difficult to appreciate in dermoscopy. So we'll be using terminologies like network, globules, structures, regression. Those are the stuff that, kind of when you do a lot more of dermoscopy, if you do any courses or any online reading materials on dermoscopy, you become conversant with these terminologies and when you're given descriptive features of anything. So I think there's one of the things, part of the learning of this, because dermoscopy is kind of a long learning thing, but you can also appreciate the use of some of these terminologies to help you to become confident in your description. It's just like, making any descriptive features of lesions in dermatology. You use macules, papules, plaques, and things like that. The more you use them, the more you see them, and the more you become familiar with what you're looking at. This is another 3-point checklist. This is a dysplastic nevus, which has asymmetry of pigment and also of color and structures. So you can see the asymmetry. It's also got an asymmetrical shape. It's also got atypical network there. So you can see the distribution of the network here is not the same. So this is atypical network, but there are no blue-white structures here. Okay, so this is dysplastic nevus, but difficult for anybody to differentiate without biopsy. So dysplastic nevus is basically a histological diagnosis. Clinically, you worry if you see this, you're referring it for 2-week wait because it's very difficult clinically to distinguish between a melanoma or early melanoma. Whereas this is tells you high suspicion of a melanoma is an asymmetry in color and network, and you've got atypical also network there, so the distributions are typical. There is also some blue-white areas there in the middle, so where the blue arrows is pointing, this regression. You've got other features suspicious of melanomas that you can see there in terms of the networks, and probably some pseudopods and things like that, which will help you make you get worried, but we'll come to that. But in 3-point checklist, it's got asymmetry, it's got atypical network, it's got blue-white features. Nasty. 2-week wait. Okay, I'm going to pause there here before we go on to the second and third part, which is also part of the standard approach in terms of doing this diagnosis assessment of a lesion. So this is going to be the 2-step algorithm. So we'll come back in our third video, part 3, with 2-step algorithms, and I'll see you soon. So I'm gonna stop sharing here. And I'm going to come back in the next video, and we'll carry on with the 2-step algorithm. See you soon.